Dan Vyamukam, I thought I should give you an opportunity to comprehensively address this question. I want to imagine it came from young people, and so Dan, please prepare to answer that. Then the recommendation about embracing digitalization, I think the chair, in his remarks, he mentioned about embracing tweeting. I have just opened a Twitter account, hardly 3 months ago, so I think I am in vogue. But there are many people, my age mates, who don't have Twitter accounts and will not be able to talk to these young people unless we embrace this digital trend. So I agree with this recommendation 100%. Monsignor, you mentioned about the need to involve young people. I know that we tried actually to involve the leadership here at MOBS, although I'm not sure if the invitation reached. So if it did not reach the guild president, apologies. And like the co-chair said, anything that went wrong in preparing this, you blame me. So the buck stops here. However, we have tried to engage young people in organizing and executing this event. The masters of ceremonies for the 3 days that will be here are young people. We have the president of Uganda National Students Association, the gentleman, and we have also the lady who is leading amongst young people living positively with HIV and AIDS. We have also presentations which young people will be taking lead in. So of course, we had limited time and there is as much that we can do, but certain engagement of the leadership of this institution, if the invitation didn't reach them, I must apologize. Dr. Sali, the rise in maternal transmissions, in view of the more potent drugs and the technologies and the access to testing, it's absurd. But for me, from the data, what we are seeing is that first and foremost, some mothers or people who are enrolled into care recently, they are enrolled when they already have HIV disease. Their CD4 count is low, about 30% of the people newly enrolled. And then we are seeing reduction in retention in care. Beyond that, I don't want to speculate. I know you are a scientist, and so I don't want to apply analysis here. But like I said, tomorrow there is going to be a session that unpacks the impact of PMTCT program. An assessment was done, and I'm very sure that your concerns will be very well addressed there. But could it have been due to COVID-19, I think was your question. Perhaps yes, but perhaps also no. Let the science tell us. Dr. Nelson Mandela, injectable drugs. Dr. Dan, are you near? There are questions I wanted to give you. So I wanted also, you also comment on the approval process for injectable, long-acting injectable drugs as a way of preventing HIV in Uganda. So you have two questions, HIV services and injectable drugs. But maybe before you come in, there was a question of, with these gaps that we have highlighted, how are we engaging donors to make sure that they are aptly addressed? First and foremost, we have a national HIV and AIDS strategic plan. So all this information will go into formulation and fine-tuning the plan. In December, we are going to be doing a mid-term review, and certainly this report is one good point to consider. But specifically, for example, our major donors, PEPFAR, and Global Fund. When they are compiling their submission to get the resources, they are guided by the National HIV and AIDS Strategic Plan. The Global Fund application will be going in March next year, and they are already knocking at our door to give them the priorities. So all these will be going into those applications. For me, I think the bigger question is, because even with the partners, we are not able to resource the entire response and to address even the areas we thought were priorities, which will help us to reduce the response. And therein comes the efforts for increasing domestic resources. I think we need to, as a country, start looking at efficient mechanisms of using the available resources to reach more, but more importantly, we have to, the Waganda say, if you are in the family of the deceased, it is you to hold the part that is married. So I think really this is our problem, and we need to boldly come out. So Dan, over to you. Dr. Dan.
Thank you, Dr. Bagambe. I'm called Dr. Dan Biamkama, Head HIV Prevention, Uganda AIDS Commission. Starting with the HIV testing, I think there are two answers to that. The first one is about finances. In the context of limited resources, we aim to target our limited resources where they are of maximum benefit. So with that in mind, the HIV testing policy tended to shift that we target those at high risk to minimize wastage of resources. So that's how we target it. But secondly, you will remember that our HIV testing policy has been evolving. Initially, we were doing HIV testing for prevention. But as we moved along, policy appeared to change to do HIV testing for treatment, where you must maximize the chance of identifying somebody who may be HIV positive. But there is current consultation to revise the policy again, where we shall re-emphasize testing for prevention, so the concerns of the members may be addressed. But I must also highlight that we have HIV self-testing. So if you are excluded by the health facility because you really don't meet the criteria, because of cost concerns, you can go to the pharmacy and buy an HIV self-test kit and really satisfy yourself. So with the HIV self-test kit, we believe everybody will be reached, including those who will not really be considered a priority at the health facility. Considering the injectable, the long-acting pre-exposure prophylaxis, the National Prevention Committee already approved that the government needs to have these on board. The Ministry of Health guidelines have all been updated to have Kabla, the long-acting injectable for PrEP, accessible to all. What is remaining is for us, for the Prime Minister to give us the money we need to buy for all Ugandans who need it and make it available. And I'm very sure once she comes, she will tell you that she will find the money. Thank you.
Thank you. Vincent. We have a bit of a dilemma. We would want to hand over to the next chairs, but the Honorable Minister is not yet with us. The Honorable Prime Minister and the Honorable Minister, I think they're just about to arrive. And we have a suggestion to pull some of the sessions that were to happen in the afternoon, which would help to answer some of the questions that are really coming out from here on prevention, on new methodologies, on also prevention of mother-to-child transmission. So please bear with us as we try to identify a speaker who's willing to come and give that presentation so that we don't stay too long on today's program. We'll hand over to Lillian. Lillian Mosco. She's the chair for the afternoon, or we continue.
Lillian is not available. I think
So
for you
no?
can close your session. when we get the
Okay, I would like to hand over to my chair to close the session, and thank you very much for the active engagement in this session, and then we will see who's willing to come and present. Thank you.
Distinguished colleagues, distinguished participants, guests of honor, all protocol observed, I would like to take the opportunity as your chair for this morning. Thank you very much. First, thank the presenters and also to thank the participants, both physical and also online. We are proposing that some of the issues that were raised are connected with some of the presentations, are linked to some of the presentations in the afternoon. So we were suggesting that we have a break, a short break, after which then we can come back here. A short break, social break, health break for interactions and also to enable us to see how we can improve on the sustainability, financial, social sustainability of our program. With these few words, ladies and gentlemen, please allow me to suspend the meeting. The meeting is suspended for 15 minutes. Thank you.
Hello. Welcome back from that powerful session. We are really intrigued by the discussions, and we hope we can make the conversations continue. You can continue with the conversations under hashtag #EndAIDS.
Smartphone, the most affordable smartphone in Uganda. You get to enjoy free 1 GB for 1 whole year. My Airtel 4G smartphone, your best value for money. Visit the nearest Airtel outlet today and get one at only 250,000 Uganda shillings. Airtel, the smartphone network.
The Ministry of Health informs the public that there are confirmed cases of Ebola in Uganda. We, however, urge the public not to panic as the situation is being managed. The Ministry of Health further reminds the public to be on the lookout for any persons who may show signs and symptoms of Ebola. These include high body temperature, abdominal pains, diarrhea, vomiting, bleeding from the body openings such as the nose, eyes, and mouth. Please inform the nearest health worker immediately if you see anyone with these signs and symptoms. To prevent Ebola from spreading further, please take the following preventive measures: regular washing of hands with water and soap, avoid handshaking and hugging, avoiding any contact with any suspected Ebola patients. Any person who dies suddenly should not be buried but reported to the nearest health worker or LC1 immediately. For further information, please call the Ministry of Health toll-free number on 0800-100-066 or send a free SMS to your report on 8500. This message is from the Ministry of Health with support from UNICEF and World Health Organization.
The Ministry of Health informs the public that due to the ongoing threat of polio outbreaks in Uganda, it will conduct the second round of the National House-to-House Polio Immunization Campaign from Friday 4th November to Thursday 10th November 2022 in all the districts of Uganda except those currently handling Ebola outbreaks.
During this second round of the National House-to-House Polio Immunization Campaign, health workers will visit homes, schools, places of worship, markets, daycare centers, shops, and playgrounds to immunize all children aged 5 years and below, irrespective of their previous vaccination status. This house-to-house polio immunization campaign does not replace routine immunization.
Parents and guardians, please remember to have all your children aged 5 years and below immunized against polio during this second round of the National House-to-House Polio Immunization Campaign from Friday 4th November to Thursday 10th November 2022. The polio vaccine is safe, effective, and free.
This message is by the Ministry of Health with support from UNICEF, WHO and partners.
Welcome to Friends Stadium. Everybody's ready. Wait a second, not everybody. Come on, dude. It's the FIFA World Cup. You're going to lose your seat, the ritual seat, the lucky one. Losing more than a seat, your team is going to lose. Where are you, dude? The match is about to start. Your friends won't hold out much longer. Excuse me. Finally, everything is in the right place. Hey, other hand. And you, do you have everything you need to believe? That's right! The Voice is coming to a city near you. From the 21st of October to the 10th of November, you get a chance to showcase your talent. Prepare a 1-minute MP4 video of yourself singing and upload it to thevoice.africa to register. Make sure you have a valid Airtel number, and if you're shortlisted, you will be contacted to come in for the live auditions.
Well, don't just stand there, let's go!
Music your passion, Africa your stage. The Voice Africa, connected by Airtel.
My name is Elijah Dickens Mshemeza. I'm a professor of political science and a member of Parliament, Shema County South. The issue at the table now is how to deal with Ebola as a pandemic. I want to appreciate the efforts of NRM government and the Ministry of Health in particular. Really, Ebola is being contained. What we need is to follow the guidelines of the Ministry of Health and government. If the government says these districts are under quarantine, we should respect the quarantine. If the government advises that we should not be in crowded places or their contacts of Ebola should be reported, we should do that. I really believe once we cooperate with the government, we shall also not make an alarm to the international community that are coming here to support our tourism sector. So really, Ebola is under control. Our people should not fear. Let them respect the rules of the government.
I'm Dr. Vyakatonda, Member of Parliament, and I think this time around we have heard about Ebola. I think we want to first of all condole with those families that have lost relatives and urge members of the communities to step up their vigilance. I think what we need to know is that now we have just left COVID, we have just been from COVID. You remember the lockdown of COVID, they had a lot of far-reaching impacts on the economy, and the country is still recovering, and indeed the entire world. So as we're developing mechanisms to see how we overcome that, again Ebola is in the country, and I would like to urge the ministry really to continue awareness campaigns. I think what is important this time around is to really rally the communities on SOPs, because one of the methods that has been used is the lockdown. Lockdown would be okay, but I think it has also negative impacts on the economy. So what is important is to ensure that at least we put up our ears on the ground. What I know is that the Minister of Health is gifted with the most technical people. The Minister is a professional, the PS is a professional, and I think we can contain it. So we need to benchmark with the neighboring countries like, I think they have been in the neighborhood, and we need now they have been managing. So as Uganda, we need also to manage and ensure that at least we get over, so that at least we go into our usual economic activities and operations. So let's really step up our vigilance on Ebola. Let's ensure that at least we avoid the number of all those SOPs underlined by the Minister of Health, and then we can be able to cope up with the number. So what I want to believe is that as communities, we are not empty vessels, we have ears. So let's really listen and know the causes, how do we mitigate it. At the end of the day, we should be able to manage it in the shortest time possible, and we go into economic recovery programs. I thank you so much. I remain Dr. Vyakatonda, working Member of Parliament.
Viewers and listeners of UBC, I'm Ekanya Geoffrey, Member of Parliament, Toronto North County. The issue of Ebola and health is a matter that we all have to handle it as citizens of Uganda and Africa. Ebola is real, it kills. But the good news is that it has cure and we need to manage it very well. And simple, let us avoid contacts, let us wash our hands, let us avoid congested places, let us not eat unnecessarily, let us maintain hygiene. The way we manage COVID, we will defeat Ebola like it has been defeated in Sierra Leone, Congo, and other places. But let us maintain hygiene, avoid contacts as much as possible. And treat, if you feel any ailment, seek urgent medical help in the nearest health facility. Avoid going to traditional health facility to seek for treatment. Ebola is managed under the Western medicine. You can pray, but don't sleep in a church that you are there to heal Ebola. God will bless you and heal you, but go to the main gazetted government hospital. And you can receive God's blessing. From gazetted government hospital, Ebola is easy to be defeated.
Nazi midrati modi pelo gwara maru oguzuli Dennis mojio marchadre memu mevodo ayo da Ebola dri azo Ebola ro amebere Congo ase amebere anda Liberia pe asite azo da mesuki ni Chad amavo de abo amadu Uganda dia eringa toni mubende pe ase fiven kambala abo ama yo gamete ni lo ba mamba ne bata ba mojidri ba ma teba gei afaze kadre bazi maru arapi susuru ni mi olo badabada ko de mavuti obezo Ebola be su atitani mbele yo amani arojo amadi Uganda de maura na eborle arome yo mokocha de ako so azor kanga mi bera angoni mi ngazor kadre amadi aru PS kanako wesenal PS lera inira mi chodra mbele askuni gamete ngani dri so mi bu mbele ko ma ide mi emi obe yo gamete ni da agaite madede mavuti amani chozo amaza kozo bene Ebola erichi Ebola razo azichopi fepi angwa madin dijarani okorsile ate amagei gamete ndimo amagei tendo mezivini adrone mafe iyo de maatiati awadfo minimereris
Nian again, David Atoa, until a member of Parliament, me a Gago County. I made a poor attack to Tuan, Luak, me Uganda, Gamenta, me Uganda, a take Karama, Watiga Poyen. Combedi, Watigi game, Mador, for attack a dada, any Ebola. Ebola, Combedi, Tiga Necodano, which I get to Western Uganda, Combedi, Nontio, or Kampala. Makombere tiga miyo banya madit matek to twal bot gamente. So pira tek peluak wan ma wa winyu lep ni wa gwa kwa wa pien yot koma ye lonyu yot koma ye kwa yot koma ye teach yot koma ye nyim ka koma yot chiti kero meti kid gi more ken e wiloboni chi amira ligu ni gwa ke kid loka tuo corona tekinen kid la nyut mo me tuo corona do chake kumi e cha gwa on remo Ichao chayo liro matek tiga maki timbe e chiri oriat pe yot werenan dakta wek dakta obet kikero me pimi dakta obet kikero kitimo kikwere kum in menano ngo matiga yeli kitua ngo kage no ne Ebola chipe yor mi dakta tiye bien tu Ebola ber tu maraja deda wiwapo tunko malame Uganda gulu Ebola timo ne rodana madua man pe achakine Man pe achakene me bini Uganda. Uganda dong tiel ne mi ario ne chala dek ma Uganda tia karita kara matek ma aki Ebola. Put corona karakara man do Ebola do nyu. Cha mira lake luak me Uganda mira lake luak ma kumalo no timbe o gwoke ki Ebola o gwok lokom yot kom mamewu pe obet karube ki dana ta wangu betwolo yitu betwolo obet ka neno ne yot kom gina chiel mamire wa kere tich papira tek me gwako kwawa wa tich ku bed yot wa gwako pajo bed yot wa kube ki tiu jem muker mamete mamago lokom don lobo ko bed mabe mane ye chigo na botu matera da ne po beda ta bien kado yini to ngati momo beleu ka kare dong pere kado yini to tich dong pere kado yini to ko jo dana ki gwa ko pajo dong pehe yina chiel li pira tikki pira tek na ma chiel bod la chwe dog bod gamenta me Uganda chamira legu ne gwa lo ka yot kom matek pe ko ata pe bed ata wakuni waglok kom yot komi wakono bed mabe mana e kwera na botu ana poyo matek legu gum de la chwe goku to coin ministry manen lo kom yot kom de geno tiu matek ka chiel ke jo ma pat matamo pe lo ka yot kom padano me Uganda kai papoyo la chwe meru gum ba
Gonya basabin de kolle aswoge aninya honorable Chemtai Phyllis woman member of parliament Kapchorwa district amita amsawa ni barangala le ngalega Ebola portonyolel nyogujo bandañ bora yarle kinye makargena ne corona nyogi tojeng mai lagabu denañ de nyale ci ngungu ci doy angu le porto jo lay mata ko woy karamni angu ngayati angu kwane garati odedi kwane nane konyagi kwane mbo itigi an kwane ulo to kolla yada kinyla yege gas ngala cewti jola ngat palaga ci jala gum nyona bo tan jagura la Ebola dene bor tan bare Ebola le muje je ciagarak tage lane ciagarak tagal ne mendeg na me por de nyale muja mungi dene le manamo dene yogati nge lag na mak yogati nge bor won por tan nyama ci danyam nyona ga por tan nyama nyona yogati nge lag unam da por tan nyam nyona nyone kinyla je sama pandañ le ay ku careful ndo agarosto je garom le ma jem de jiting dog ay wege nan nyo jagura la social distance anak to je gisi taman le man jiting de man gis bay ge mbawun yak